Okay, today's skill is going to be administering an enema, and first we start with co-wipe, which is check physician orders and for allergies, assemble appropriate equipment, wash hands, identify the patient, introduce myself to the patient, provide for privacy, and educate, explain, and evaluate. So with our order for the enema, I've already positioned this patient appropriately, side lying, recumbent position, and I've put down my drape because this is usually a pretty messy job. With our enema bag, we would make sure it's clamped off before I filled it up. Place our solution here in the bag, make sure it's warmed to about 105 degrees. And then with the little lubrication that comes with it, we lubricate the tip as well. Sometimes they're pre-lubricated, but not always. Okay, and then put on my gloves because, yeah, we all know why. And I also forgot to say we'd prime this tubing first as well before going in. So taking the cap off, when we go to insert,
I'm just watching and changing.
When we go to insert, we go 3 to 4 inches, maximum of 6. Making sure it's pointed up towards the umbilicus, and then once we're in as much as we need to be, we would unclamp the tubing, kind of helping hold this in place so nothing comes flying out. Starting at the bed level, and then we'd slowly raise up to about 12 to 18 inches, so that way the solution can flow in the way it needs to. If the patient complains of any pain, discomfort, or fullness during this time, we would clamp off and wait about 30 seconds. And then if they were like, okay, I feel better now, we'd go ahead and resume. If they were just not able to tolerate it any longer, then we would just stop altogether. Once the amount that I need to administer it is complete, we would remove, and I would ask them to lay flat on their back for a certain period of time. Each enema is different. It takes different amount of times for them to work. Some of them work immediately. Some of them take like 5-10 minutes. It just depends on whatever is ordered. Once it's time to assist them to the bathroom, I would either bedside commode, bedpan, or maybe they can ambulate and get up and go. It just depends on the situation. After they have had their bowel movement, I would help them with their pericare and make sure they're all cleaned up, put them back in bed in a safe, comfortable position with the bed rails up, call light, and then I would go take off my gloves and clean myself up as well. And then, as always, we document everything when we're done.